When I speak about people having a forehead lift, the immediate thought that I think most of my patients have is unnatural or plastic appearing or Elvira or Spock or something kind of exaggerated where we're talking about lifting the forehead this high and this high, having a V shape to the forehead where it's kind of going like this. Honestly, that's pretty hard to do. It doesn't happen in many cases that we're trying to achieve that kind of lift. And if we are, I have a conversation with a patient about what our real goals are. What we're trying to do with a forehead lift, from the plastic surgeon's standpoint, at least from my standpoint, my opinion, is that we're trying to reestablish the shape of the brow as it goes up and onto the bone and stays high on the bone as it goes across. Sometimes that just means moving the very outer part in the temples. Sometimes it means moving the outer half along with that outer part. And the way I like to talk about it is as if you're like, think about the tail of the brow, the very last part of the brow, as the arrow pointing on a big grandfather clock. And you want to just turn that maybe about a half clock hour or a full clock hour upwards to where it points a little bit higher and at that angulation. You're not trying to lift the forehead. And I think one thing that makes people worried that it's going to be an unnatural appearance is they're worried that it's going to lift the whole forehead. And in fact, that is something that used to be done very frequently with forehead lifting surgery, is that we would go and cut out the muscles in here to kind of help with some of the wrinkles that happen there. By the way, that's a little risky because there are some blood vessels in there, a couple of nerves that if you nick one of those nerves, you're going to get tingling and numbness and funny shooting pains all up to your scalp, and that sometimes can last a very long time.